Many of our providers are working with 210 practices. One of those 10 practices is working nearly exclusively with our ACO and Medicare-covered patients, but they do similar work for other 10s for patients of Medicare and other insurers, but not connected to the ACO. Is there a need to reach out to those other practices to collect data to report on patients of other insurers?
I tried to answer this question in the last set, but I think it bears a little bit of emphasis. An NPI is a TIN NPI to Medicare. They are a different entity with different quality reporting obligations within each TIN, that's tax ID number, in which they work. ACO quality reporting under the APP is specific to the patients seen by all TIN NPIs billed by the TIN participating in the ACO. TINs that don't, that is, tax ID numbers or practices not participating in the ACO, have no bearing on the quality reporting for the ACO. The patients seen by your NPIs in any other TIN practices not participating in your ACO are not relevant to your APP quality submission. Thanks, Gwen.
And Gwen's next question. Some of the TINs in our ACO have a second line of business. They participate in our ACO and they serve their local hospitals as hospitalists. For our APP quality reporting, do we need to include all of the patients from the hospitalist line of business that are not engaged with our ACO?
Great question, Gwen. Very interesting. And the answer is, I'm afraid, an equivocal yes and no. That's not all. That's not bad news, though. You need to report on all eligible patients for each of the three APP measures from all patients of all payers in each of your participating TIN practices. For quality reporting, it doesn't matter if the patients are attributed to the ACO or not. If there are patients eligible for these measures in those TINs, they will need to be reported, subject, of course, to the 70% data completeness requirement. On the other hand, the good news is few, if any, of the hospitalist patients in those practices should have eligibility for any of the APP measures. I took a quick look at the specifications for those measures, and I found no emergency department, hospital inpatient, or hospital outpatient visit codes included in the measure eligibility specs. Our thorough analysis of your billing data will show if any unanticipated coding practices or other billing dynamics extend your reporting liabilities beyond the ACO patient group. Thanks, Gwen. Interesting question.